Often people think of food security, it means, well, in general, at the national level, there are enough of the staples, be it millet or flour, just to provide everybody enough calories. That definition has evolved over time that includes that everybody has access to the food they need, not just calories, but both safe and nutritious food that they need, and that's also acceptable to their cultural conditions.
What is the impact of USAID food assistance in the global landscape of nutrition and food security, and what is the work that the organization does?
And at USAID, we work across three of the major sectors that need to deliver good nutrition. So we need to make sure, be it through agriculture, food systems, or food assistance, that we're not looking just at calories and economic growth. We're also looking at making sure those foods are safe and nutritious. We're moving from just feeding people to nourishing people. Secondly, there are essential actions in the health system that both the health interventions, but also nutrition interventions, for example, delivering life-saving vitamin A supplements. And of course, on the humanitarian side, that core to humanitarian assistance are these life-saving nutrition services. Undernutrition is an attributable cause of 45% of under 5 deaths. And for those children who survive malnutrition, we know we fundamentally deprive them of their optimal cognitive and physical development.
The impact of COVID-19. What is the projected short-term and long-term impact of the pandemic on nutrition?
This pandemic is perhaps the gravest threat to our progress in nutrition, because every system that families rely on to nourish their children and their mothers, every system is being disrupted at the same time everywhere in the world. There's a group of researchers came together to try to project what could be the outcome. That combination of increases in wasting combined with a decrease in access to nutrition services could result in 283,000 additional child deaths. And it was estimated within that same publication that the increase in resources needed globally would be about 1.2 billion a year to offset those alarming projections. I want to be optimistic, as they are not destiny. That's what will happen if we do not take the necessary actions to avert those grim projections. What's been incredibly encouraging is the degree to which these decades of investment in capacity have resulted in a huge ability to innovate, to use data, to pivot programming, to adjust programming, to start trying to mitigate the impacts of this. Many countries are expanding their social safety nets to account for this increase in poverty. And how do you, when you expand those social safety nets, make sure they're designed in a way that will optimize nutrition impacts? Also, make sure that in the very necessary focus on stopping the pandemic, nutrition is not positioned as something as nice to do, we can wait, that we need to actually stop the virus and secure our nutrition gains at the same time.
At the recent Food Systems Summit, the U.S. announced a commitment of $5 billion through Feed the Future, the U.S. government's global hunger and food security initiative. What will the priorities be, and what should we anticipate seeing in the next 5 years?
One is scaling up large-scale food fortification. So we're making sure we're securing access to essential vitamins and minerals. Second, if you look at most consumers in low and middle income countries, their big interface with private sector partners is small and medium enterprises who face real challenges in producing nutritious foods. And those challenges are not just technical from the nutrition, but how do they actually have access to the sorts of financing that they need to grow their business in a way that will give consumers more and more access to safe, nutritious foods. Thirdly, a new Feed the Future Innovation Lab on food systems for nutrition, which illustrates exactly the sorts of evidence that need to be generated to guide governments and the choices they make. And then fourth, this real focus on children's diets, also mothers' diets.
Now let's talk about climate change, which is a big topic, COP26 happening in Glasgow. You actually talk about 3 priority areas to help mitigate the effect of climate change. What are these areas, and why are they critical?
It certainly is disrupting every system, including particularly the food system. At the same time, we know the global food system is a major contributor to greenhouse gases. So we do need to have a food system that reduces that. As we look at the reforming food systems so they are contributing less to the environmental crisis, that we also are taking into account that we have to do it at the same time we are securing access to safe, affordable, nutritious foods. If we want to save kids' lives, it's the most powerful thing we can do is invest in nutrition. If we want to secure children's futures, it's the most powerful thing we can do. And it really is not competing with any other priority. It's really foundational to achieving every other priority.
Thank you so much, Shawn Baker, for joining us today.
Thank you. A real pleasure.